What is the potential for bone TB recovery with early care? Imagine catching tuberculosis in the bones early enough to turn the tide in your favor. When bone tuberculosis, including spinal tuberculosis or Pott's disease, is diagnosed promptly, the outlook is quite positive. Early treatment mainly involves taking specific medications for several months, often starting with a combination of drugs like rifampicin, isoniazid, ethambutol, and pyrazinamide. Usually, the initial phase lasts about 2 months, followed by a longer continuation phase with rifampicin and isoniazid for 6 to 12 months or sometimes longer, depending on how the patient responds. Research shows that with timely and proper medication, about 85 to over 90% of patients with bone tuberculosis recover significantly or completely. This means many people experience relief from pain, regain movement, and avoid long-term deformities. In cases where the spinal cord is affected, early treatment can lead to neurological improvements in around 70 to over 90% of patients. Many who initially could not walk regain their ability to move around with proper care. Surgery is not always necessary but is reserved for severe cases where there is spinal instability, significant deformity, or abscess formation. About 20 to 60% of patients might need surgical intervention to help restore stability or decompress nerves. The good news is that early care helps prevent serious complications like permanent deformities or nerve damage. When treatment is delayed, the chances of lasting problems increase and recovery becomes more difficult. Most patients who follow their treatment plan carefully and complete the full course of medication have a low risk of relapse and a low chance of death from bone tuberculosis. The overall prognosis is quite favorable, with many returning to normal or near normal function. It's important to remember that each case is unique, and individual responses can vary. Consulting healthcare professionals early and sticking to prescribed therapies are key steps toward a successful recovery. Early diagnosis and treatment truly make a significant difference in the fight against bone tuberculosis.